want to lie back for me on the bed?
Yeah.
Please, thank you so
Keep
much.
my shoes on?
Yeah, absolutely.
Katie is a 30-year-old primate, which means she's having her first baby, and she is roughly 20 weeks pregnant, coming in for a routine antenatal check.
The top of your tummy is, that's your
Because Katie's a healthy young woman, she has the options to deliver wherever she'd like. Regardless of whatever background she is from, medically or obstetrically, we would be able to support her in whatever choice that she would like to make. The importance is her knowing what her choices are and knowing what's available to her. So the entire purpose of this appointment today was to be able to discuss her options, discuss where she can give birth and what the differences between them are.
Excellent. All sounds perfect today.
My name's Dr. Simon Leclerc. I'm an accident emergency consultant based in Middlesbrough, and I'm the Deputy Medical Director of the Great North Air Ambulance. So effectively the point of putting doctors onto aircraft is to deliver the resuscitation room to a critically injured or seriously ill person at the scene, so that we can start to provide that life-saving treatment before they even get to hospital. We on the air ambulance kind of held back and targeted towards the more seriously injured people. They include people trapped in road accidents, falls from height, stabbing, shootings, people who are seriously injured who need advanced intervention.
Okay, so I'm going to have a little look in his airway. He won't open his mouth very far. Is there anything I can see to suction?
You can see some secretions, just some blood.
Right, so let's give him a bit of a jaw thrust.
Okay, so that opens his airway and that noise stops.
Okay, so we'll try pop the LMA in next.
In the ambulance service, you have to carry a lot of heavy things and you need to protect your back. One of the heavy items that you have is the response bag, and what we don't want you to do is to hike that over one shoulder. So Matt, if you could just bring the response bag out a little bit, and if you could turn behind and pop your arms in, and we're going to be using the power of your legs to stand forward, so if you can come and step forward, lovely, and if you can adjust both straps so there's not uneven loading, and if you can wear it higher up the back, that will also protect your back.
And then we want to cover the resectoscope, covering the holes and the ridges, and you can see it's nice and viscous and it adheres well. Once it's on, you just wipe it around so that you get good lubrication for ease of insertion. When I'm looking for a gel to use, I would want that gel to be quite gloopy so that it doesn't just drip off the instrument. It needs to be sterile so that it doesn't introduce infection into the patient. It's important to have a single-use gel because you don't want to risk cross-contamination by using the same pot of gel for more than one procedure.